Hello, everyone, and welcome to our webinar, COVID-19 Daily Symptom Tracking Technology. I'm Jennifer Koenig with Health Check 360. We have a great presentation for you today. But before we get started, I'd like to take care of a few housekeeping items. We will have time for questions at the end of the presentation. If you have any questions, please type them into the questions section at the bottom of your screen. We will also be posting a recording of the webinar online. So if you would like to replay this presentation at a later date, it will be available. Today, we have Health Check 360's Michael Kelly with us to demonstrate the COVID-19 Daily Symptom Tracking tool and administrative portal. With the CDC's recommendations for reopening workplaces and some states even requiring daily symptom tracking, Health Check 360's tools can help companies keep their employees safe and healthy. With that, let's get started.
Thank you, Jennifer. It's a pleasure to be connected with everyone on this afternoon on such an important topic. As states reopen and employers look to continue to protect their essential employees and begin the process of returning employees to their work sites, symptom tracking, along with social distancing and proper PPE, has become the primary recommendation for employers, schools, and other organizations to return to work, school, and play. What we want to accomplish today is to demonstrate how this can be done easily for you and your employees with the flexibility to meet your business's unique needs. We're going to do that by spending most of our time in the application itself. But before we jump in, I still think it's important to answer why we have to take these steps. Most importantly, employers and organizations need to implement symptom tracking because the CDC and other leading health organizations prioritize that strategy as a way to prevent the spread of symptomatic employees and symptomatic cases of the virus. Employers have to be able to demonstrate that they have put measures in place to keep sick employees at home. This is a crucial element to mitigate future risk of litigation. The ability to demonstrate that you have appropriately and recommended policies and procedures to prevent the risk of COVID-19 will be essential in avoiding future lawsuits, which we're already seeing throughout all industries. Additionally, as states reopen, we are seeing symptom tracking being a mandatory requirement in places like Colorado, New York, Illinois, and others. Not meeting the minimum expectations of the CDC and the states that you live in could cause concerns for litigation down the road. Although it's very clear that employees can ask these types of questions today, it is still important to be thoughtful of regulatory requirements around PHI and how we ask these questions. Many companies that are manually monitoring employees are not likely to be meeting these standards. So as we think about, even though that we're allowed to ask and gather the PHI associated with COVID-19, we need to be thoughtful about how we store it, where we store it, and what standards are in place. Outsourcing that with people who've always done that or are experts on that tends to be a good idea. And I think the important last piece for everyone to consider is that the technology gives us the ability to better support your employees and the programs that they have available to them to give them the follow-up support that they need. Consider an employee who is told that they can't come into work because they have symptoms. What do I do next? The platform gives us the ability to instruct the employee to resources that are available to them so they can get the best possible health outcomes. And it improves the communication between you and the employees. We've also seen that programs like this are well received as they demonstrate to the employees that the employer is taking all of the necessary steps to keep them safe. So with that, let's dive into the tool that helps you execute on the COVID policies and procedures that you're implementing today. And in order to do that, we're going to dive right into the actual website and application itself. So as you see here, we have the monitoring dashboard for a sample group of employees. And I've got about 20 people loaded into this group. It's important to consider what we're trying to accomplish with this. And real-time data is really one of the most important components. It's impossible to accommodate varying shifts and schedules of each individual company with locations in every time zone in the United States. And so real time addresses that issue, meaning that at any time during the day, an administrator can see the status of their employees. And what I mean by status is we show that over here. Green is someone at work. Orange is at home and symptomatic. Red is they haven't even completed the survey and shouldn't be at the work site. And so this last status is someone who might be a new employee where we've sent the registration link, but that employee has not yet completed the registration, and so consequently hasn't completed the survey. All important buckets to know, and any employee could fall into any one of those. This gives you the ability to filter in real time to see who is at work and who is at home, and you can do so by location. So for my Michael Kelly demo group here, I've got the group as a whole and subgroups. We can help you set this up so you can think about subgroups maybe not just as locations, but individual business units or different geographic entities. And so we're just going to look at Michael Kelly here today. And for most people, when they log in, they're going to want to know who is not coming in today because they've demonstrated COVID-like symptoms. So we simply say who is at home, symptomatic or diagnosed, and what we get is a quick summary of those who are not at work and why they're not there. So you can see that instead of having fixed Excel sheets being emailed to you or an Excel sheet that you have to examine yourself, what we're creating is essentially real-time ability to look at the group as a whole, or to say, hey, Michael Kelly, what's going on? I've just finished a survey, and I can edit that individual and resend anything that I might need to be able to do. So very user-friendly and yet very self-serving, because we know that time matters with these types of resources. And essentially, we can use this even to keep track of your follow-up conversations. So if someone stays home and you have a policy that says, hey, you need to seek testing or you need to seek a provider, you can click in and keep track of those conversations, both through what we call disposition, which is, hey, they were told to self-monitor, they were directed to a testing center. But also we can look at notes and other components for those individuals. So this usually brings the first question, which is, hey, I've got hundreds of employees or thousands of employees or tens of thousands of employees, which we have groups of all sizes onboarding. So how do I manage eligibility? And I think that's a really important concern. And I think that many of the symptom trackers that we see in the marketplace aren't addressing that effectively. The first tool, and I really think about this for large employers or when you bring employees back in increments, we've built a bulk uploader, which is a very simple tool that allows people to use Excel and CSV files to upload large groups of employees at the same time. And we've done that in a way that's thoughtful so that you don't need to filter your own systems to just find the terms and the ads. You can just keep uploading the same census file that has all of your current employees. So as I click into this file, you'll see the simplicity of what we're asking for. Employee ID to differentiate between employees, groups or locations, name, email, date of birth and gender, phone numbers if available, and then alert contacts. And the question is, what are our alert contacts? Well, alert contacts are actually, I think, two of the most important components of the platform itself. So, for example, when we go down to someone who completed their survey this morning and they were held at home because they demonstrated symptoms for COVID-19, we want to make sure that we have the ability to communicate with the company in two ways. The reason we have two alert contacts is, one, for most organizations, there's a corporate resource, either in HR, security, or some other area, that's managing this program at a global level. The second is there's an operational concern, right? If the company knows that Michael Kelly is not coming in today, we've built essentially the ability to let both that administrative level at the corporate location know, and also someone, possibly Michael's boss, maybe the operational lead, or a lower level administrative resource that's in charge of that region, location, whatever it may be. This allows for two things. One is your corporate entity to have a good sense of what's going on with COVID-19 and its impact on the organization. But also, two, it helps you manage the operational workflow of unexpected absences from people manifesting COVID-19 related symptoms. And so many groups, though, might be smaller. They may be able to add their ad in terms in a more manual way. And we've also built that ability. So if I just press add participant, you can see that I've already got the group loaded. I can put in the employee ID, first name, last name, date of birth, gender, etc. And this will actually immediately add a participant to my platform. And the moment I add that, it'll send an email to that participant to actually register them for the program. And that's a good segue to actually say, okay, let's say I want to register Michael Kelly. So I'm actually going to send the registration link to me again. I could have done it by filling out a new employee, but since it's easy and I have my contact information here, and it gives me a reminder that, hey, this is going to reset this user to incomplete, actually to hasn't completed registration. I'm okay with that for the purpose of this vendor, and it tells me that the message was sent. So to the email address that I have on record, I'm going to receive an email. I open it up, and I am just asked to follow a link. So I follow that link, and it opens my web browser. All of these websites are mobile optimized. And so for the purpose of the experience, I'm actually at this time going to change over to my cell phone. And to do that, I'm going to start sharing from my cell phone. Now that I have my cell phone showing here, you see that I followed the link from the email, and it asked me to confirm my enrollment. This is the opportunity for the participant to tell us when they want to be alerted. Again, we don't expect, especially for large organizations, tens of thousands or hundreds of thousands of employees, to know exactly when the most opportune time is to be alerted prior to their going to the work site. So we let the participant fill out. So I'm going to say I want to be alerted at 7 a.m., an hour before I usually start my work day. I'm in the central time zone, and I want it every single day, not knowing when I'm going to be going to work and when not. And when this happens, I can be alerted in just email, just via text, or both. I'm going to prefer text messaging because for me, that's the easiest way to do this and not clutter up my inbox. And I will confirm my enrollment, and I get an all set. Keep an eye out for your service invites. They'll be delivered to my address and my text messaging that I provided. And so I'm going to return back to my administrative page because I'm going to show you guys an example of a survey from the participant's point of view. So I still have Michael Kelly up here, and my survey is not going to go out until the time and place that I sent it at 7 a.m. But we've gotten the request for the ability to do multiple surveys a day, especially in certain states that are asking for that. And an administrator can actually send Michael Kelly a survey at any time. This starts a new session, right? So even though I had one this morning, it's going to say that I'm incomplete until I finish the second one. And I'm going to say, okay. And once again, the message is dispatched. Now, the exciting part about this, as I move back to my phone, is that I can show you guys that I have a new text message from HealthCheck 360. It says that I need to follow this, complete this survey an hour prior to going to work that day. I follow the link, and I'm now taken to the COVID-19 symptom assessment. And this is the intro. It's based on CDC recommendations. And we're going to use the assessment to determine if I should go to work or not today. So I'm going to start. Do I feel feverish? Not today. Do I have a cough? No. I have a slight trouble breathing. And I have some new symptoms that are very specific to COVID-19. And I was in contact with somebody, but I haven't been traveling. And here, I'm going to certify that I'm being truthful. And judging by my responses, you can probably tell that I am. So I accept. And what do I get? Here is, I think, an important point of the technology is that I get a big stop sign for one. It says, do not go to work today. It explains to me that my answers have indicated that I have possible symptoms of COVID-19. But what I'd like to bring your attention to is 1 through 5 here. these are going to be unique to you, the employer, because what we want to do is we want to customize the program to what works for you and to utilize the benefits that you have available. So for example, almost every step after making sure that symptoms aren't life-threatening is to actually say, hey, you need to contact HR, and that gives HR the opportunity to lay out your policies and procedures on how long they need to observe, if they should go be tested immediately. Those vary from company to company and significantly from industry to industry. So we can write those things in here and encourage a communication with you, the employer, to reinforce those. Many groups are asking us to then say, can you help me emphasize our telehealth resources? Telehealth provides a physician engagement that can evaluate and triage the symptoms that are present, and without the individual having to expose themselves outside and really maximizing the benefits of the health plan, they can get an intervention with a physician and determine if they need appropriate testing or not. Lastly, many groups are asking our nursing teams to follow up those participants to make sure that they take the steps recommended in the care guidelines and the policy procedures of their employees. And the last piece is the biometric piece, and we want them to record their temperature at this time. So I record my temperature here, and I'm going to say 101.5, and next, I'm telling the truth, and it gives me that stop sign. What's great is that all of this happens in real time. And so as I move back to the administrative portal here, what you'll see is that I now have a completely new status and disposition for Michael Kelly. So you watched me complete the survey, and in real time, I now have new survey information, new profile information, and alerts for Michael Kelly. And this helps us and kind of demonstrates how, even in very large organizations with multiple locations, shifts, and schedules, your team will always have the latest disposition and the latest information on each individual employee. But there's one last piece that we really have to think about in the provision of tools, and that really is around overall reporting. And so as nice it is to have all of this information here, what we've also done is create a COVID-19 monitoring report. And what we're really trying to do here is create three main components. The first is to give a visual of large amounts of information, right? So let's say it's day one of your program and you sent the registration link to all of your employees. Over here on the right, I'm going to highlight, we have a registration rate. So what is the number of complete registrations versus incomplete? And the exciting piece is for each one of these graphs, we have the ability to download the Excel sheet as a report for you and the information that's feeding it. So we're going to be able to give you all of the information and answers you want, again, in real time, and both visually and in a data table format. So most recent questionnaire status, are they complete or incomplete? Again, we can highlight certain areas. There's some flexibility and dynamic aspect to the graphs. And I think this is probably the most important graph. We may be expanding kind of the look and giving this more real estate. But for the most common question that you go into this is going to be, what is my overall employee status? How many have not completed registration? How many are symptomatic? How many have not completed the survey? And how many are eligible for work? And I can highlight any of those areas and you see the overall percentages. And again, the ability to download the data and to view the data table. I'm not going to do that today because I've just populated this with some generic data so that we can all see the different outcomes. As time goes by and more testing becomes available, we also want you to be able to track the overall testing status of your population. So who haven't received a test where it's not applicable, how many employees have received a positive viral test, how many are negative, and how many have tests scheduled. So you can see, again, what's the testing status, And then for just the people that have completed a test, what are the testing outcomes? So negative and positive in your overall population. And then the same thing for antibody testing here on the right. The last piece I want to really touch on is I think the most exciting piece from a data analysis point of view is kind of two areas. One is, can we determine the efficacy and the risk of our organization over time? And the second is kind of the overall trend. And the third is, can we use the data to potentially identify hotspots or opportunities for intervention before we see larger outbreaks? And that's what these last two graphs are doing. So one is when the C-suite asks, what is the total impact of the virus on our absences after we've returned to work? So this is a count of the number of people that are absent on any given date. And then the dotted line is the 5-day moving average of that number. You know, as with the current trend, what we hope to see is that companies will see, it probably increase for a while and then hopefully decrease forever. That's what we're all working towards. But this will give you real-time reporting and the ability to customize a report for your organization and for the leadership of the organization to give them some immediate feedback. The last piece here is the symptomatic rate per 100 employees. And as you see, the left side of the graph on the y-axis has all of my locations, location 1 through 8, or again, the groups that we've set up. The second, the number that we're tracking is how many people are at home with symptoms per 100 employees. And again, we're tracking this in real time. And so what we want to be able to demonstrate through the symptomatic rate is by using a denominator of per 100 employees. At each location, we can see your areas that are having the highest levels of symptom outbreaks. And when we see that at a location-specific level, we can actually give that data and information to you, which you will have in real time. We don't need to give it to you. You can use that information to say, hey, we have a problem at the location in Chicago. We need to separate employees more. We need to dial back the number of employees present. We need to take actions because it looks like we're indicating or leading towards an outbreak. And I think that giving you the data that you need to make decisions over time is how the symptom tracker and the administrative portal gives us the ability to contain and provide as safe of a workplace as possible. I think I might have left out that we can actually filter these charts by location and specific areas, which will allow you, again, to be really thoughtful about, hey, my registration rate is great in some areas, it's really poor in others. Again, actionable information and actionable data for you as an employer. So as I think about kind of wrapping up this conversation, we really, really want to focus on the ability to take action on the data that's being collected and to really be thoughtful about the trends in our populations and locations so that we can act on it and make meaningful impact to protect our employees. And so as you think about this platform, to me, it's one of the first steps that you have to have. Testing and temperature on-site screenings and many of those components are all going to be important, but having the ability to track all of those various components and prevent symptomatic cases from running your work site is probably the most important concern. And with that, I can't wait to answer your questions and talk a little bit about what you guys are doing and how we can help in this space. So at this time, Jennifer, I'd pass it back to you and we can do some Q&A.
Great. Thank you so much, Michael. We appreciate your time today and sharing your expertise. We've gotten quite a few questions in already. And again, if you do have any questions, please type them into the question section at the bottom of your screen. And Michael, our first question, some people are looking for a little bit of clarification. Do employees access the tracker on a mobile application or is it on a website?
Yeah, great question. So in order to serve more industries and more varied levels of technological expertise, We actually, the entire application is based on a mobile optimized website. So I use the term application as a software application. But again, and the intention of that is that we wanted to avoid as much as possible the requirements around setup, registration, and to increase the ease of use for employees across all industries. And so what we found is that sending a text message with an embedded link, press on the link. I don't need to sign in every single day. It knows the link was unique to me as a user, so it already knows who I am. Prevents both companies and us and employees from having to deal with username and passwords, and from having to learn and essentially kind of understand and administer an entire application that all of those things go with. So a mobile optimized website is the short answer to your question.
Great, thank you. The next question, are the admin and reporting capabilities that you demonstrated today included with the tracker that individual employees access, or are the admin pieces add-ons?
No, to me, that's the core functionality of the resource, right? The reality of it is there's millions of free trackers out there, maybe not millions, but you could go to the CDC, right? But if you don't have a place to aggregate that and to be able to use that to make business decisions or to use the results of those trackers, that's kind of the key component to keep work sites safe. It's not, the strategy is typically not just around asking people to complete a tracker. It's asking them to complete a tracker, verify it, and verify it for the employer so that that employee can report to the work site. And people who don't do that, the employers can prevent that employee from coming to the work site or not gaining access to the work site. So the administrative portal is 100%, I think, kind of the connected and part of, certainly not a buy-up.
Great, thank you. Is there a limit to how many locations or subgroups can be set up?
I'll have to ask, but I don't believe so. Mainly, it's a question of how complicated do we want the initial setup, and frankly, the requirements of the employer. And so we tried to differentiate this platform in a couple of ways, and one of those is being able to accommodate challenging and spread out employee organizations. So, some of our clients have 20, 30,000 employees at 600 locations. We've built a couple of things to accommodate that. One is the ability to have a location for each of those. Two is the ability to have tiered administrative reporting. So we have the ability to say, this administrator can only see this subgroup of locations or business units. There's an administrator above the top of that. There's an administrator above the top of that, if you think about our org structures. And so, again, although the EEOC has interpreted the ADA in times of pandemic is that we can have this kind of information, most of our clients and companies that we talk to want to make sure that we're still limiting PHI access to the right employees, and that often time requires appropriate what the developers call nesting within the administrative user rights. So I don't believe there's any restrictions. If my coder was here next to me, he might say when we get into the thousands or something like that, it introduces new issues. But no, our intention was to make it as flexible as needed on a per employer basis.
Thank you. We've got a few more questions around cost. Can you walk through the pricing for this?
Yeah, absolutely. Again, this is something that we think we built was not to make great deals of money off of, but because we think it's the right thing to do. And as we see the state guidance, it's something that our own clients and employees needed. The other reason is something that we thought we could do well. Health Check 360's background in corporate health and well-being gave us a history of creating assessment tools, of protecting PHI, and using the data from those tools to provide insights and actionable steps for our clients. And so we just repositioned something that we've felt that we've been good at for a long time to the current needs. And so for an exact quote, please let us know. We have a resource online, and contact your Health Check 360 sales executive. But the price range is pretty simple. It ranges from under $1 to $2 and change, depending on group size.
Michael, the next question is around implementation. What is the implementation time frame, and does the size of the group matter in terms of that implementation time frame?
Implementation, I think we can get moving on this kind of stuff very, very quickly. We're bringing our first groups on right now. Obviously, it's a new resource, new tool, and the times have called for it right now. I think the average group from signing of contract to usage is probably less than 2 weeks if we have all the census information and all the data available. As you saw in the demo, the registration process can be as simple as soon as you have that information available on who's eligible, we can load it up and it goes. And so very, very quick. And the questions that we work through in partnership are, what do we want those instructions to say? What are the customized instructions going to say? You know, we need to understand your employee benefits and what resources we want to highlight. And obviously we kind of want to understand your policies and procedures in case someone reaches out to our resources, whether it's a nurse or customer service, and they have a need. And so we want to make sure that we can be good advocates for your employees.
Michael, do the admins receive notifications when employees receive the "don't go to work" message, or do they have to go in and check the platform?
No, actually they receive notifications. And so for huge organizations, we've had certain individuals identified, but we've also created new inboxes for some to say, hey, this is where we want the written tally to be. But for most organizations, simply we have 2 people getting a live notification via email. So again, as I kind of talked through in the demo, most of the groups that we're working with are sending one to a corporate resource, oftentimes in HR or security, who's kind of managing the overall strategic approach to the project. And then the other can be a supervisor, a boss, or a location lead, kind of ensuring the safety of that particular location, team, or unit. But also to inform the operational aspect of your business that somebody's not coming to work today. And so that real-time notification via email is a really nice resource, and separately from having to administrative access. So a different way to think about that question, Jennifer, might be you could restrict the administrative access portal to certain individuals and still have others be notified when a certain employee is not going to come to work, so that their boss or their unit or their location gets an email that says Michael Kelly is not going to be at work today. Yeah,
that's certainly helpful. Can employers send the survey to only subsets of workers?
Yeah, and that's incredibly common. Most of the groups that we're working with are bringing their employees back in waves. And so simply the ease of use of the bulk uploader and the eligibility management, where you can, with a push of a button, add or term people, or just in large groups bring people on, we can just, as employees are selected to come back to work or trickle back, those individuals are entered into the program. We don't need to start with all, if you have 1,000 employees total and you're only bringing back 200, what we would do is we'd load and register the first 200, and then we would add them as you work through your employee population. So that's very common, and certainly we're getting pretty much used to doing that at this point in time.
Michael, are there any issues with requiring employees to use their personal phones for the assessment?
Yeah, that's a good question. Obviously, I would advise you to defer to your own IT team. The reality is that if someone's worried about data charges via text, we can still send it via email. So we were trying to accommodate that consideration. As you saw in the employee registration process, they can choose whatever is most easy for them. So that cost component should go away. As far as, people being concerned that they might have to pay wage workers or things like that, I don't have a lot of concerns about that. I'm not an attorney, so you'll have to defer to your own employee benefits attorney. But the reality of it is as you saw me work our way through the survey, it takes less than 30 seconds. And from what we're seeing from most of the regulatory agencies today, right now, safety is being prioritized over other concerns like that. And, I don't think most people or organizations are concerned about the 20 seconds of required time. I think what most people are really focused on right now is how do we protect and do the right thing as we look to get people back to work.
Great, thank you. How do the care management services factor into this, and what type of follow-up is provided with care management services that could be added on?
Yeah, so there are opportunities for care management add-ons. Essentially, at the most simple level, is that Health Check 360 has for 30 years provided case management, condition management, chronic care management services to health plans and employers all over the country. So we have a team of nurses and doctors already present that, as you consider your COVID-19 response policy, and especially in the context of this conversation, as you consider if someone is told, stop, don't come to work, what steps you want to take to support that employee and what can be kind of a scary thing, our intervention from our nurses is a great step. And essentially the role our clinicians would provide at that point is to answer any questions the employee has. When we provide these services, we typically get from the employer the available benefits, resources, network information, et cetera, so that we can advise them to seek primary care or telehealth or the best possible resource. Again, we want to be good custodians of both the health plan and great advocates for the user to make sure that we're utilizing the employee or the employer resources effectively and providing a great resource and support to that employee who probably is asking questions like, does this mean I need to get tested? Do I just sit and wait? How long? Where do I get tested? And we can help with those kinds of questions.
Michael, the next question is around messaging and some customizations. Can we customize the messaging for different audiences? So, for example, students and staff members at a college or a university.
Yeah, so the question set is fixed because we're basing those on the CDC's recommendations, and so we're not allowing those kind of to be changed. The instructions and the intros can be customized exactly to those types of audiences, and so that depending on the group, we can customize those benefits and instruction set to see to make sure that people get the right support and take the right steps after getting a stop sign, or even the right steps after getting the green go sign. What we're looking at right now is as far as the context and text of the emails and text messages themselves, I'll have to look into that. I believe those are fixed on a global basis right now, which is why the text is very, very simple, which is just a simple reminder to complete your survey. I will look into the email question to see what level of customization we can provide on either a company by company or group by group location basis. But good question, and we'll follow up on that.
Michael, we have a few questions that are related to our consulting. So first, for employers with employees who are working from home, but may occasionally report to an office or visit clients, how do you implement the symptom tracker?
Well, again, Health Check 360 is not going to ultimately determine what your policies and procedures are, but I do believe the technology can help accommodate those things. So I believe that most employers have a choice to make then. If they don't know when certain employees are going to come in, or it's a erratic schedule, we're talking to a lot of groups that are simply asking their employees to take these tests daily, because I don't know if I'm going to come in today or if I'm going to come in tomorrow, but you can tell that the purpose would still be, the purpose and the consistency of data becomes very important. So, you know, if you have people that are working from home, but they might pop in on Thursday, whoever's eligible to go to your work sites where there's going to be other employees, I think most are looking at, hey, I'm going to get them on the platform and answering the questions at least on a Monday through Friday or potentially 7 days a week type basis. We can talk through those things, and we also have some relationships and others that can provide recommendations on those types of policies. I think I would just regroup you. That's why the flexibility of the portal is designed to say, you know, if somebody only knows they go in on Monday, Wednesday, and Friday, which we're seeing also, as you saw in the participant sign up, they can select Monday, Wednesday, Friday to get a reminder to complete the survey. Some groups are saying anybody that's showing up on any schedule should complete the survey every day. And there's merits, honestly, to both sides of those arguments. We can't ultimately make those decisions for you, but we can certainly have a conversation on the pros and cons of each.
The next question related to some of the consulting that we offer is what happens with when employees receive the stop or the red light message. Do they have to do testing? Do we help employers in setting some of these policies?
We'll certainly have conversations and consult and help you guys talk through those challenges. What we can't do is that today, you know, when looking into those questions and trying to formulate standards, the reality of it is that COVID expectations and regulations are now being customized down to really the county and municipality type level. And so without knowing exactly where you're located, what state you're in, what industry you're in, by the way, if you look at New York State, for example, we're reopening in regions, geographic regions, based on a metric board on cases. And then within those regions, certain industries are being reopened in stages. And so it's really hard for us to make strong recommendations without understanding all of those variables. Because again, going back to the New York example, you have a region that's open or not open. Then you have an industry that's open or not open. And then New York State provided different recommendations for each one of those industries within each one of those regions. And so the right answer to those kinds of questions might be dictated to you, but it also might be something that we just need to frankly talk through depending on what space you're in and where you're located and your level of exposure. Sorry, I couldn't be more specific on those. Those are tough ones as far as getting to those policies today is not a general conversation anymore. It's very specific.
It is very tricky. Is the assessment available in other languages like Spanish?
Yeah, the first version here that's available for groups coming on in June is only available in English. We are working on the Spanish version. We hope to have that out later this summer. So if that's a requirement, contact us and let us know, and we can give you updates as that service becomes available.
Michael, this next question is around security. What types of safeguards and privacy rules are used with this tool?
Yeah, so again, our background as a TPA, as a medical management company, and as a wellness company, we've been collecting, protecting, and reporting on protected health information for the better part of 30 years. And so without getting into too many specifics, this is not new for us. The security is that we have, everything as far as data storage, because it's HIPAA, PHI related, is stored domestically. So there is no offshore cloud storage. We are SOC 2 reviewed and verified that we're happy to share, and we've gone through numerous on-site and remote security audits from our partners and our largest clients on a regular basis, including I think we do quarterly penetration testing at this point. So security for me is something that we're passionate about. We have to be passionate about, and is essential to be in this business. I also think that the inverse of that is why it's very, very dangerous to place this type of service and this type of data either with little startups or small tech companies who don't work in healthcare, or it's also why I mentioned in the presentation that doing it manually and asking your employees to create a system might be met with some peril also if this has to go on for a long period of time, which I hope it doesn't, but I think we're still probably early next year away from a potential vaccine. So the time frame on doing this is likely a half a year to possibly a full year.
Michael, this next question is around those people who may not have access to technology. How do we accommodate those employees without smartphones or even email?
Well, I wouldn't say that this product today is a great resource for a group that's completely offline. And the reason why is there's no way to just build paper versions, because we don't want employees with symptoms to showing up to your parking lot to get to the front door. And then, by the way, share a desk with pencils and pens and sheets of paper verifying this stuff. That's not kind of safe in the broader context of what we're trying to deal with. The way HealthCheck 360 is trying to address that is although again not in version 1, we are working on a IVR solution, so a telephonic keypad solution, so that someone without email or access to technology could still on a daily basis complete that. Again, that time frame is to be determined. The focus right now is getting the technology platform out into people's hands because of the amount of demand that we've received for this. But we would like to leverage the same data and expectations and what we think is a really great resource to groups who have employees that wouldn't have any of those contact points. And so what the development team is working on is an IVR solution that would be connected to the same administrative portal, so that your employees that could access the technology that we demoed would continue to use that process, and that others would be able to use IVR. So again, I hope that that's something that will be out this summer. And if that's a high interest or requirement for your client or for you personally, let us know, and we'll give you the same updates as that's rolled out.
Michael, the next question is around some of the notifications again. So do administrators receive real-time notifications of non-completed surveys?
Not the non-completed. They get real-time notifications of the people who take it and are at work. Now, the same report, by the way, is available on smartphones, and the administrative portal is mobile optimized. So if you want to look to see who's incomplete, you can look at that in real time. The challenge there is that employees may have different shifts, right? So many have a reminder that goes out at 7 a.m. by their choice because they go to work at 8. Others are going to work at 3 p.m. for second shift. And the system is smart enough to manage all of that between them and the individual. But what we wouldn't know is at what point in time would you want that report as an HR administrator, because all of your second shift employees would be incomplete if you wanted to be notified at a certain point in time in the morning. It creates a huge level of complexity based on shifts, timing, and, by the way, geographic regions. And so that's why we left it up to, if you want to look into that particular question or any of those questions, that's the importance of the real-time administrative portal that I dive in and I can see and answer those questions down to an individual level. Again, you can do that by filtering on the dashboard, or you can go into the visuals and actually click into who hasn't completed yet today, and an immediate, within seconds, you've got an Excel sheet of those numbers, and you can find who they are. So I think that's the intention, is that the information is always available to you.
Great, thank you. So our next question is around implementation again. Do we have the marketing to educate employees on how to use the tracker?
Yeah, so the Health Check 360 account management team has built a set of fairly straightforward, simple communications. Remember again that in the effort to make this as easy as possible to use, it's not very complex, right? We're going to auto send an email to everyone, the registration email. They just need to recognize that they have to follow the link. And then once they follow the link, they select the days and the time that they want and hit OK, and they're in the program. And then we hope that you saw that once they're in the program and they get a text message that it's very simple to do every day. So I follow the link, I answer my 7 questions, and I'm done. And then remember, there's the customization that if you're done and get a stop sign, that we even then provide the communications there. So the implementation process becomes very straightforward. It's not like rolling out a complex employee benefit where they have to make decisions or understand various components of a program. It's really about them understanding why the employer is asking them to do what we're asking them to do. Maybe some basic stuff about how this is now okay to ask. And then a reminder is to make sure that they get it done. And so the communication process is pretty direct and to the point. We get a lot of questions, Jennifer, and I don't know if these might be pending about, hey, how do you make sure that people do it every day? Groups that are doing this, typically the company policy is you can't come to work and you're not going to get paid unless you complete your survey. And so that's what gets people to do it. And then after that, because it happens every day, it becomes part of the workday. It becomes habit. And it's not about incentives or overly communicating or a lot of things that we talk about in some of our other areas of expertise. This is about a reality and an expectation in the current environment. And I wish there was a softer way to say that, but that's just kind of the reality.
Absolutely. At this point, it's really about employee safety.
That's right.
Most employees are really wanting this reassurance from their employers as well. They want to feel safe while they're at work.
Yeah, if you were going to define where this program lies, it's in your occupational health and your safety strategy. This is not an employee benefit. This is a requirement. You know, this is in the same way that if you had somebody using a circular saw, that they took the right steps to make sure that they weren't going to hurt themselves on that saw. That's not a nice to have. That's an expectation of having that job. And that's kind of what's new in this environment is that, hey, the expectation right now is I have to divulge some health information to make sure that as a whole, we are safer at the work site, which is going to be a strange change for a lot of employees. It's been strange for me building products about, you know, that open up and are more transparent about specific health measures, you know, for employers. But it's very well documented, and it's kind of a strange world that we're living in right now.
Great. Michael, any closing thoughts for our attendees today?
No, I think that we're super excited to both provide, I think, a necessary solution to the marketplace right now. We are learning as fast as you are, as every day the news and COVID and the science around COVID is changing. And so we are evaluating and adapting. You know, we've evolved the question set even in its earliest releases in a very short period of time. But we're also open to the feedback. And so as we add clients and as we add groups who need this, you know, we certainly want to hear from you on how we can make it even better and more useful to employer populations. But we think it's an absolutely essential first step for companies that are either one, protecting their essential employees, or two, thinking about how to bring people back safely.
Great, thank you so much. That concludes our presentation today. We hope everyone enjoyed the presentation. All attendees will receive a follow-up email with links to the recording and the contact information. And as a reminder, we have another webinar coming up next week, and that webinar is highlighting how employers can support those symptomatic employees. If you're not already registered for that webinar, you can access the link on our blog or LinkedIn page. This concludes today's webinar. Take care and stay healthy.
Thanks so much.